Hi there, I'm Dr. Marlene East and I'm a licensed counselor from Panama City Beach, Florida. I completed an education doctorate in 2015 in curriculum and instruction with a specialization in instructional technology. I'm excited to share my dissertation research about mental health mobile applications in counselor education. Even though you may not be a counselor educator, this presentation may be useful as you think about integrating technologies into curriculum and what factors may influence student engagement with those technologies. I invite you to think about how this study may apply to you and encourage you to ask questions at the end of the video. My dissertation research was an effort to blend counseling, education, and technology. For my research questions, I investigated what factors influence counselor educators' values of mental health apps as therapeutic tools and what factors influence counselor educators' intentions to teach students about mental health mobile apps. I also investigated how and to what extent our graduate training programs are contributing to the technological competence of future counselors, particularly regarding training them to evaluate and integrate mental health mobile apps. So what is a mental health mobile app? Mental health mobile apps are assessment, education, and treatment interventions accessed via mobile phones. If you search in the app stores for topics such as anxiety, bipolar disorder, depression, mindfulness, OCD, phobias, PTSD, substance abuse, stress management, and suicide, you will discover thousands of apps. Mental health mobile apps are included in the 2015 term MH². Associations for educators and counselors have ethics codes that direct professionals to actively understand how to use technology resources to better serve clients and students. Accrediting agencies such as Council for Accreditation of Counseling and Related Educational Programs, or CACREP, have technology-related education program requirements that require evidence of the use and infusion of technology in program delivery, instruction based on the most current knowledge, and instruction based on an empirically based techniques, procedures, and modalities. Educators must be diligent about adapting curricula to include research-based efficacy evidence regarding new technologies. In my literature review, I found several studies regarding efficacy and evidence potential of various apps. If you'd like to read these studies, you may access my dissertation and reference list through ResearchGate, Google Scholar, or through your library's ProQuest dissertation and theses database. The research is rapidly increasing, especially with the growth of journals devoted to electronic health and mobile health subjects. In creating new knowledge, it is useful to look outside our main field of expertise. We know that looking at something from multiple angles is called triangulation, and I applied technology use and acceptance and innovation diffusion theory to learn more about mental health app adoption in the counseling field. In the area of technology use and acceptance, much research has been undertaken. Venkatesh Davis and colleagues have continually worked to study and refine our understanding of the factors that contribute to our behavioral intention or conscious plans to use a technology. This 2012 diagram of unified theory of acceptance and use of technology is the most recent model. The terms on the left are independent variables, the terms on the bottom are covariates or modifiers, and the terms on the right are dependent variables. The variables on the left are direct influencers of behavioral intention to use a technology and of actual use behavior. Notice the variable on the top left, performance expectancy. What will I get out of using this app or this educational technology? What is in it for me? Over time, performance expectancy has been found in research to be the strongest predictor of behavioral intention to use a technology. Effort expectancy. How much time will this take? How difficult will it be to use this technology? Social influence. Are other people who are similar to me using this technology? Facilitating conditions. Do I have all the devices, cords, Wi-Fi, and tech support that is needed to effectively use this technology? The three variables at the bottom left were added in 2012 model. Hedonic motivation, enjoyment from using a technology, price value, and habit, whereby our daily use of apps or other technologies sets the stage for us to use similar apps and technologies. You will notice that some of the variables on the left are modified by age, gender, and level of experience. Another theoretical foundation I used was innovation diffusion theory by Rogers. This theory is included in the unified theory. However, if we are concerned about why a particular profession is lagging behind in technology use and acceptance, it is important to look more specifically at the social influence piece and study how an innovation diffuses throughout a social system. Here are the attributes Rogers identified that feed into the decision to adopt an innovation across a social system. Advantage over prior ideas. For example, can using a therapy app on a mobile phone have advantages over books or paper and pencil homework? Does using an iPad to complete classroom assignments have advantages over printed workbooks? How compatible is the innovation with the needs of potential adopters? Is this app or educational technology compatible with my clients or my students? Alignment of technology with the students and the educational objectives is critical to learning. Complexity of use is akin to the effort expectancy we see in the unified theory. Trialability. This is the degree to which an innovation may be experimented with on a limited basis and offers the opportunity to learn by doing. I tested the impact of trialability in this study. Observability of outcomes is another attribute of our decision to adopt an innovation. To what degree is the innovation effective? Are efficacy studies available? How easy is it to access and understand those studies? Now let's address research design. For this study, I used a sequential explanatory mixed methods approach. First, I collected quantitative data from counselor educators and analyzed it using SPSS. Then I interviewed 10 educators and analyzed that qualitative data with NVivo software. Lastly, I evaluated the relationships between the two phases. In the first phase, counselor educators completed a 4-part questionnaire. Section 1 collected general demographic information, level of app experience, and training about mental health apps. Section 2 was divided into sections based on the unified theory and collected data about views about mental health apps. In Section 3, educators downloaded and interacted with an app. They used this section of the questionnaire to critically think about and evaluate that app. I chose the PE Coach app for prolonged exposure therapy for PTSD as it had efficacy studies and was developed by a reputable government organization. In Section 4, educators again completed Section 2. This helped me measure the impact of trialability on attitudes towards mental health apps after interacting with a reputable app. For participants in my study, I chose counselor educators because as leaders of required foundational training, they have the potential to influence the thinking of future counselors about technology. Universities from every U.S. region were represented and 132 educators participated. 86% had doctorate degrees and 80% also had a professional license. Apple was the preferred mobile device. Over half of the educators had no mental health apps downloaded and only 40% had only 1 to 3 mental health apps. 74% said they had low to no experience. 81% had no training on mental health apps. Only 2% indicated their programs have a required course on mental health technologies. Out of the group of 132 educators, 10 participated in online interviews that lasted about 30 minutes each. Included were professors who immigrated into technology and educators who were born into technology. In the first phase, I investigated 9 hypotheses. First, let's address the findings indicating no significant differences. Findings indicated no significant differences between digital immigrant counselor educators and digital native counselor educators in terms of average number of health apps or mental health apps downloaded to their personal phones, and no significant differences between the immigrants and the natives in terms of intentions to teach students about mental health mobile apps or in their values of mental health mobile apps. The levels of online course offerings in the counselor education programs also did not significantly influence decisions to teach students about apps or values of mental health mobile apps. Now let's address significant differences found in the study. First, results of a hierarchical multiple regression indicated variables in the unified theory that have been used in many other fields to study adoption of new innovations may also be used to determine the factors that influence counselor educators' decisions to teach students about mental health mobile apps. The covariates and independent variables were entered in a hierarchy of 4 models, and all 4 models contributed significantly to the regression model. In fact, the variables taken together accounted for 51% of the variance in behavioral intentions to teach students about mental health mobile apps. Significant differences were also found from the results of paired samples t-test that compared the scores on behavioral intentions to teach students students about apps and values of mental health apps prior to interacting with a reputable app, and then following that interaction. The key finding here was the importance of trialability, in that interacting with a reputable app significantly positively influenced educators' intentions to teach students about apps and their views of mental health apps in general. This finding speaks to the importance of guided interaction with technologies in order to enhance engagement with technologies. 8 main themes emerge from the qualitative interview data. First, while educators have an overall good impression of mental health technologies, they aren't yet teaching students about these technologies. They have concerns about client safety, privacy, and security, yet they also see benefits of using mental health apps in therapy. They noted the need for more training. Another common theme was their interest was sparked by this study, and some even decided to work on integrating mental health apps into their curriculum. Other themes were how to integrate apps with therapy, how to teach students about apps, and whether or not training regarding mental health technologies should be voluntary or involuntary. In comparing the quantitative findings to the qualitative themes in the mixed methods analysis, some results were confirmed and some results were contradicted in part, and the qualitative themes explained in more depth the quantitative findings. The lived experiences of educators indicated there may be more differences between the digital immigrants and the digital natives than the quantitative data indicated. For the counseling field, the results indicate that educators see the benefits of mental health mobile apps and that more training is needed to help diffuse these technologies throughout the mental health social system. The results also imply the importance of social influence and trialability to enhance engagement with new technologies. This applies not only to mental health apps in the counseling field, but also to other innovations and educational technologies. When we are trying to get a client, student, or faculty member to use a technology, we need to use our social influence by modeling the use of that technology, and we need to have them interact with the technology, either in our presence or with our guidance. By interacting with technologies under the guidance of professors or teachers, students may discover the personal relevance of the technologies, and this helps dispel uncertainty or apprehension in the process. This study also highlights the value of considering the variables in the unified theory of technology use and acceptance theory when choosing technologies. After many years of testing and revisions, Venkatesh and colleagues indicated this theory explains as much as 70% of the variance in intention to use a technology. In my study, the theory explained 51% of the variance. The variance in my study was likely lower because it was measuring another level in behavioral intention. I was not looking at a person's intention to use apps themselves, but at their intention to teach others to use apps, which adds additional layers of responsibility and even liability. As you think through these variables and the connection to intention to use a technology, you may gain a sense of how well the technology will be adopted by your students or colleagues. Think now of a new innovation or educational technology you are interested in using in a course or for administration. Maybe it is a course management system or an online bulletin board. Perhaps it's a robot and curriculum designed to teach physics. With age, gender, and level of experience in mind, ask yourself or have your planning team discuss what are the benefits of this technology over prior methods. How much effort is required to use it? Is it difficult to use? Is it time-consuming or confusing? How effective is the social influence for this technology? Will students accept it? Will parents and school leaders support it? How much of a technical support team is needed? Do we have that kind of support? How enjoyable is it to use this technology? If it is frustrating, engagement will be low. How affordable is this technology? Can our system afford it and afford to support it? Do the projected users already have enough of a habit in using related technologies that it will not be too much of a stretch for them to use this new innovation? Thanks for taking the time to learn about this research. I hope you learned some things that will help you make technology decisions for yourself and your institutions.